It has been sent, the full report and the one-pager and the summary, to all the members of the Regional Parliament of Catalonia and the low and high chambers in the country in recent weeks, because they are now discussing whether they definitely pass the bill on the state trans law or not. We have currently 15 trans laws, regional trans laws in the country that do not allow for self-ID in census. They do allow for it in many other aspects of life. So we know what was happening in the countries around us in September 2018. The then UK Equality Minister, I believe, Peggy Mordaunt, alarmed by the 4,400% increase in girls seeking transitional treatment in less than a decade, stuck with this figure, commissioned an independent inquiry, at least this is the narrative, that had resulted in the CAS report made public in spring 2022, from whose conclusions of the Gender Identity Unit at the Tavistock Portland Clinic that served the minor population is closed and the model of care is being transformed, deeply revised. So among other things that are well known for all of you, they observed that there is no reliable record of evaluation of the results obtained with the treatment applied, which lack medical consensus and whose protocols have been renounced by its own staff. And without a priority psychological approach based on the key questions I was saying that must be asked. First, what happens to these girls and why? And second, why is there an overrepresentation of children and youth with psychosocial vulnerabilities among those requesting for gender transitions? In addition, in December 2020, the young Kira Bell won the trial for medical negligence against the Tavistock Portland Clinic for having been induced to cross-hormone and irreversible surgeries as underage, as is happening right now in Spain. And we hope there is our own Kira Bell soon. And now there are more than 1,000 families in the UK, I believe, who have filed complaints against the Tavistock Portland Clinic and its methods. In Sweden, in 2021, the Karolinska Hospital, the reference hospital for treating gender dysphoria, decreed the end of treatments for children and underage youngsters with puberty blockers and cross-sex hormones after a longitudinal study with data showing that their mental health does not improve with treatment, and instead they do cause serious injuries. Since then, they have opted for a psychological and ethical approach to the anguish of children and youth who reject their bodies, and this is the literal formulation they use. In Finland, since 2020, based on studies with similar results of care services for children and youth with gender dysphoria, they decide to apply even more drastic measures, distancing themselves from the standards set by the World Association of Transgender Health Professionals, WPATH, choosing psychotherapy over any hormonal treatment or surgery for those under 25. The title of the study, as I said, is From Adult Men to Adolescent Girls, Changes, Trends, and Questions about Referrals to Transit in Catalonia. Well, what is the situation in Catalonia? The total volume of cases is over 5,500 people, with an exponential increase of more than 7,000%. I have to say that the population in Catalonia is 7.5 million people. New annual cases have quadrupled between 2016 and the year 2021 alone. And the year 2021 alone already accounts for 25% of the cases. You can see the rise of the 10 years analyzed, revealing the impact of COVID-19 related confinement and increased exposure to social networks, especially among children and youth. The average age has fallen 12 years from 2012 to 2021, from 34 to 20 years to 22 years on average. The transit service, the Gender Identity Unit, serves more and more women and more minors with clearly differentiated age pattern between women and men that reveals very different situations. You can see it here. We call it the fish graph. Among children from 0 to 9, men Boys predominate. In the age group between 10 and 14 and 15 to 25, girls predominate. And in the age group over 30 years, men again predominate, where they are more than 70% of the cases. There is therefore an accelerated change in the demographic pattern of the population served, from men to women, from adults to minors. The majority of cases of underage children are girls. The majority of cases of adults are men. The increase is alarming among pre-adolescent and adolescent girls. 70% of cases in the 10 to 14 and 15 to 18 age groups are women. Although the increase is also alarming in the case of boys, only between 2015 and 2021, there has been an increase of 5,700% of girls aged 10 to 14 years of age among the cases treated by the service, by this unit. Therefore, this increase is much higher than the figure that caused the first alarm in the UK in 2018 and started the independent report that has finally resulted into the CAS report published in 2022. We expect for that. We expect to have that impact. There is an equally alarming percentage of cases in which the sex of the persons treated is not recorded, reaching more than 10% in these same age groups. From the trends observed and the triangulation with data from other partial sources, which speak of non-binary girls, whatever that means, we know they are girls, it can be inferred that these cases where sex is not recorded are girls. In relation to treatment, we know that most cases receive hormonal treatment. In fact, in a 2016 report by the service itself, the unit itself, acknowledged that in 80% of cases, the prescription of hormones is provided on the first visit, regardless of age, a fact that is being corroborated by our qualitative research on cases of children and adolescents. All this makes us believe that our estimates are conservative. Reality is much worse. For example, we do not have any data on private health provisions or about pediatricians increasingly prescribing puberty blockers and hormones to young children. This is not going through the unit, but they are encouraged to do that by the law. As a consequence, many questions arise from these alarming results.